Hi, my name is Katie Lawson, and I will be doing my presentation on substance use and parenting in West Virginia. It was a rainy day on June 21st, 1963, as President John F. Kennedy stood in the state courtyard and addressed 10,000 rain-soaked West Virginians. His speech will forever remain in West Virginia's history. As the rain cascaded onto the crowd, President Kennedy looked at the crowd and said, "The sun does not always shine in West Virginia, but the people always do." Ironically, West Virginia has known its fair share of rain. Dark and dusty, as John Denver said. West Virginia has been notoriously known for its public health crisis centered around substance abuse, with one of the highest rates of opioid use disorders and overdose deaths in the nation. This epidemic has not only affected individuals struggling with addiction, but has also affected families and children throughout the state. The strain on CPS, the foster care system, and other community-based resources find themselves drowning in the wake of this epidemic. In many West Virginia families, addiction is not an isolated event, but a generational pattern passed down through cycles of trauma, limited access to treatment, and socioeconomic hardship. This study focused on intergenerational transmission of substance use and substance risk. The association between grandparent generation and parental generations, alcohol and illicit drug use was hypothesized to be mediated by the parental's poor inhibitory control. Additionally, the grandparents' poor discipline of the parentals and was hypothesized to be directly associated within the parental substance abuse. In turn, the parental substance abuse was expected to be associated with their offspring's poor inhibitory control by the age of 3. Different types of drugs can affect your body in different ways, and the effects associated with drugs can vary from person to person. How drugs affects an individual is dependent on the body size, the age, metabolism, general health, and the person's environment. Some of these considerations are poor immune system, liver, kidney, and heart problems, cancer, hepatitis C, HIV, tetanus, chronic pain, dental health problems, and if drug use is present during pregnancy, possible developmental delays and other neurological conditions passed on to the fetus. Addiction is deeply rooted in psychological processes that affect how individuals think, feel, and behave. Many people who struggle with substance use disorders also experience co-occurring mental health conditions, such as depression, anxiety, PTSD, or unresolved trauma, which can both contribute to and worsen addictive behaviors. Addiction is often serves as a coping mechanism, numbing pain, relieving stress, or offering a temporary escape from emotional distress. Over time, substance use alters cognitive functioning, impairing judgment, increasing impulsivity, and reinforcing negative thought patterns. Psychological dependence can become just as powerful as physical cravings, with users forming strong emotional attachments to a substance as a perceived source of comfort, identity, or control. Treatment, therefore, must go beyond detox and address underlying emotional wounds and mental health challenges fueling the addiction. Individuals struggling with substance use often face stigma, isolation, and the breakdown of support networks, which can make recovery even more difficult. In communities like many in West Virginia, where economic hardship, limited health care access, and intergenerational substance use are common, addiction becomes both a personal and collective crisis. Families can be deeply affected, especially when parents are unable to provide stable care, leading to increased rates of child neglect, foster care placements, and long-term emotional consequences for children. Social determinants such as poverty, unemployment, and lack of education further escalate the issue, creating barriers to treatment and reinforcing cycles of addiction. Evidence-based treatment for addiction involves approaches that are grounded in scientific research and proven to be effective in promoting recovery. Some of these instances are cognitive behavioral therapy, family behavioral therapy, 12-step support groups, medication-assisted treatment, medical detox, inpatient and outpatient treatment. Effective programs often combine medical support with counseling, peer support, and long-term care planning. In family care-centered cases, particularly those involving parenting, treatment may also include parenting education and trauma-informed care to address intergenerational patterns and rebuild healthy attachments. Increased funding for evidence-based addiction treatment is essential to the break in the cycle of substance abuse in communities like those in West Virginia. Many individuals and families lack access to quality care, especially in rural areas where resources are limited. Investing in proven treatments such as therapy, medication-assisted treatment, and family support programs can reduce overdose rates, improve long-term recovery, and sever the ties to intergenerational trauma of addiction. By funding these approaches at the community level, we create more opportunities for healing, prevention, and lasting change, and strengthening families.